Hi, everybody. Thanks for signing into my YouTube channel today. I know it's been a while since I have been on, but I have changed my YouTube channel name. I was starting on a focus of diabetes, and I have changed to focus on nursing, and talking to people about what nursing is, talk about topics in nursing, topics in healthcare, and to reach a broader population. So I hope that you find the subject interesting. And I wanted to start with people who are thinking about going to nursing school. I wanted to explain to you what nursing is. So, just to give you a little background on myself, I have my doctorate of health science. I have been a nurse for 20 years. I have my master's in nursing, and I've been teaching for about 15 years. So, I've been doing this for a while, and I have had a lot of students in my years of teaching. I've had a lot of patients in my years as a nurse. So, I bring a lot of expertise to the table, and I really am passionate about teaching. I don't want to bring where I teach at, but I teach at a large university, and I don't want to mention where that is. You could probably look me up and find that out. So I don't want to have any affiliations with my YouTube channel with the organization. So real quick, I want to talk about nursing. So those of you out there who are thinking about a career in nursing, you are picking a great career. And I know I got into nursing because I've always cared about people and I wanted to make a difference in the world. So, if that is your passion, that always makes the job, I would say, more interesting. Of course, it provides you with secure income, a secure job. It provides you with, you know, advancement in your career. Those are all pluses. But if that's your only reason for getting into nursing, you might find yourself struggling with burnout. So you have to find your purpose. And if your purpose is to really make a difference in the world, nursing might be it. And what is great about nursing is that it is very broad. So if you decide to go to a diploma program, and I'm going to talk about being a registered nurse. So if you're thinking about a diploma program, just beware that a diploma program, sometimes it's hard to get into a bachelor program. So you have to do your research ahead of time. Make sure you're looking at accredited institutions of nursing, and you could look on their website and see if they're accredited through CCNE, through the NLN, and through ASIN. So make sure that they're accredited before you spend your money in going to nursing school. So what's great about nursing school is that, and this is going to be a long intro, so this first slide, um, we'll get into here in a little bit, but I just wanted to communicate with you about nursing. So, is that you could get into so many specialties. You could become a med surg nurse, which I always, when I was in nursing school, you had to work 2 years in med surg before you could go on to work in the intensive care unit. But that's not the case anymore. They're so shorthanded with nurses that if you come from a bachelorette prepared nursing school, you could actually get hired into an ICU right away. Okay, so and sometimes they'll hire folks from an associate degree program. So, you have all these different specialties you can get into. You can get into um, delivery, like delivering babies. You could get into pediatrics. You could get into women's health. You can get into geriatrics. You could be an OR nurse. You could work in oncology. That's what I did for a while. the sky is the limit. You could do so many different things as a nurse. So this is why I wanted to talk to you if you're thinking about this. And we're going to talk about what a nurse actually does in these different roles, in these different specialties. There's so many different things you can get into. So we'll get to talk about that. So I was talking about the diploma program, and these programs usually are anywhere from 16 months to 24 months, and you could sit for the board exam. You have to sit for an examination, and if you pass the exam, you get a license, and that license allows you to practice nursing for whatever state that you're licensed in. Now, there are many states that are part of a compact license, which means if, for example, you're in a state and they offer the compact license, you could travel and work in different states. And I believe there's a lot of the states that are in the compact state category. So you'll have to do your research on that. And we have a national licensing board that you can go on and look and see if your state is a compact has compact licenses. So you have to pass the boards, you get your license, and then you can practice as a registered nurse. So um, then you have associate degree nurses. Okay, so then an associate degree nurse, you get a degree after 2 years, and then that's a building block. That's what I did. I got my associate degree in nursing at a local community college, and then I started working as a registered nurse, and then my employer helped pay for my bachelor's degree. And I did evenings, in person. That was before online was an option. And there are so many RN to BSN programs available online. You could do that online and get your BSN. I also got my master's degree in person. I went 1 day a week, and I was very fortunate because the college that I got my master's degree from in nursing actually came to my workplace. And so I went there 1 day a week for 2 years, and I got my master's degree in nursing education. So then I furthered my education and I decided to get a doctorate of health science because I wanted to have something that was more broad. Instead of getting a doctorate in nursing, I wanted to have a doctorate in health science. And I really loved it because it covers um, health and wellness. And nursing is health and wellness and health promotion. So I felt like it was a nice fit for me to get that degree. Now, there are doctorates in nursing, and after you get your bachelor's in nursing, there's so many different things you could do. You can get your doctorate of nursing practice and get your nurse practitioner license and actually see patients and write prescriptions and do all these things as an advanced practice nurse. You could become a CRNA, which is a nurse anesthetist, which is anesthesia. You can also become a pediatric nurse practitioner, a psych nurse practitioner, and the sky is the limit with nursing. There's so much you could do. And if you want to be a floor nurse and you like that, you could stay and be a floor nurse. We need them, and the patients need you. So just know that. So nursing offers so many different specialties for you to pick from. And nursing school, you'll go through nursing school, and as you have different experiences, you'll figure out what area of nursing you want to work. And you could always change your mind and you could get into a different specialty or you could advance your education. You could teach nursing like I do. You could do so many things with nursing. So let's talk about nursing and what it actually is. I have some PowerPoints here for you, and it is a science, it's an art. It's a profession that learns so much about the human body. And I always tell my nursing students that we teach you so much in nursing school, and it's hard. Nursing school is very hard, and there's Rumors on campus that nursing students and engineering students work the hardest on campus because they're learning so much information in a short amount of time. And here's the reason why with nursing. So we teach you how to assess a patient. That's going to be your core. That's what you're going to learn at first in nursing after you've done all those prerequisite classes like your anatomy and physiology, your microbiologies, your math, your chemistry. All those different classes are your prerequisite classes before coming into your nursing core classes. And when you get your nursing core classes, you're going to learn how to do vital signs. You're going to learn how to do an assessment of a patient, which are the most important skills we can give you up front because we need to know when our patients' conditions are changing. So we really, really need to know these things up front, and you'll use those skills forever in your career. You'll be able to tell when a patient is changing, and you'll be able to get the physician and you'll be able to get help in the room to positively influence their outcomes. So just know that. So you're going to learn those things up front once you start the nursing core classes. And so this is the wonderful thing about nursing. And then you're going to build on that information and knowledge. And we teach you how to transport a patient from the bed to the chair. We teach you how to perform hygiene care. We teach you how to ambulate a patient or walk a patient because you'll be doing these things in a hospital. It's very important how to know these things so that we could safely ambulate a patient because we don't want them to have falls. We want to make sure our patient is safe. That's a priority. And we teach you how to do all these skills in nursing school. We teach you a little bit of everything. Um, and you'll notice that your peers in other professions like physical therapy or occupational therapy, they're doing very similar things with mobility. And they do see patients as well. But you need to know all these things as a nurse because you're going to be spending the most time with the patients out of all the professions, right? The nurse is with the patient more than any other profession. And, when I worked outpatient oncology, I would ambulate patients, I would draw labs, I would also sometimes have to mix medications to give the patients. So nurses need to know a lot of things because you're doing a little bit of everything for your patient. And you have to utilize critical thinking and clinical judgment in making decisions. And the really neat thing about being a registered nurse is that you get to work one-on-one with all the different disciplines in the hospital, especially the physicians. You're their eyes, you're their ears, you're everything to that physician, and they use your information to make decisions that impact the patient outcomes. So just know that. So when we're talking about patients in the hospital and the time that we spend with them, we are, as registered nurses, we are allowed to make phone calls to the physician and take verbal orders over the phone and write them in the chart. And the physician has 24 hours to sign off on those verbal orders. So back when I started in nursing, we had paper charting. Now we have digital charting, electronic charting. So everything's done on the computer. So it makes life a little bit easier. So just remember, nursing school is hard, but it's so worth it. You have a lot of autonomy as a nurse, and you get to see your hard work benefit the patient. So as a nurse, you're a caregiver, you're an educator, and you're also a case manager. You're a um, you collaborate patient issues. You're an advocate for your patient. So you're doing all these roles. And education, I believe, a lot of times is overlooked, but it is so important because we need to send our patients home and they need to know how to take care of themselves when they go home so that they can take care of themselves and have positive outcomes and are not coming in and out of the hospital all of the time. We want to make sure that our patients are able to understand how to care for themselves. So we need to know how to, and this is where your assessment skills come in from what you learn in your first semester. We need to know how to recognize normal versus abnormal. And we need to know how to safely give medications, because sometimes what you're going to notice is you're going to go in the room and your patient, and I always use this example with students. If your patient, let's use this example, has high blood pressure, and I'm sure you know somebody in your life that has high blood pressure, or maybe high cholesterol, or maybe they are on some kind of medication for a chronic condition. Well, let's use high blood pressure. So if your patient's on a blood pressure medication and their blood pressure is low for you, let's say normal blood pressure is 120/80. Let's say their blood pressure is 90/50. We're not going to give that blood pressure medication because we used critical thinking and clinical judgment from what we've seen with their vital signs, but we're going to need to make a phone call to the physician and put a note in the chart and let them know what that blood pressure is and that we're holding the medication and why. So we need to use our clinical judgment and we need to use our communication skills to collaborate with other members of the healthcare team, okay, to make decisions together on our patient. So I put these examples on here. We ambulate the patient safely and we perform active and passive range of motion. These are things that nurses do. So we essentially are the heart of healthcare. So I hope that that helps you understand a little bit what nurses do and what nursing is. And it was just a brief overview. So real quick, I'm going to go over some nursing theorists that brought us to where we're at now as a profession. Okay, so you will learn this in nursing school. This will probably be content in your introduction to nursing course. You'll learn about the nursing theorists. And I can think back to when I was a nursing student, and I think about my students now, and we get so bored learning about those nursing theorists, but they really paved the way for what nursing is right now. And so I challenge you to really look at that and how far we've come and how brave they were for their time to take on these theories and just raised the profession to where it is now. So we could attribute what we are now to these people who have paved the way before us. So let's move on to the next slide. So before we move on to the theorist, I thought this slide was great. And these are some steps to remember when you go to nursing school, okay? Know what you know and know what you do not know, okay? Work on what you do not know. When you're studying for tests and you need to pace yourself, please don't be someone who crams the information the night before a test. To be successful and to hold on to your information, you want to go over the material and the information throughout the time. And, if you have to walk away from the information, if you're becoming overwhelmed, it's okay. If you want to go for a walk, if you want to do some deep breathing exercises, do some yoga, go out with a few friends for lunch or dinner, and then come back to it, okay, with a clear head. So those are some coping mechanisms to remember when you're in nursing school. If you're having trouble with a subject, don't be ashamed to ask for help. Your school should have tutors available. Your teachers, your professors should meet with you if you have questions. Don't be afraid to ask. There is no such thing as a dumb question. Your teachers, your professors are there to help you and support you meet your goals. Shadow a nurse before going to nursing school. If you know someone that's a nurse, and you are thinking about nursing school, and even if you don't know someone that's a nurse, you can always communicate with someone at your local hospital and see if they have shadow days, if they have someone that you could shadow, and follow them around and make sure that this is something that you want to get into before you do it. This might be something that you love, and this might be something that you might say, like, I don't know if this is for me. So it's always good to know that information ahead of time before starting. So we're going to move on to the next slide. So these are just a few people that I have on here, and I think I have a few more listed on here. There are some theorists in nursing um, to represent the history of nursing. So we're going to move on. So you probably all have heard about Florence Nightingale. And Florence Nightingale is known as the Lady with the Lamp. She was a British nurse, and she was known for being the founder of modern nursing as we know it. Isn't that amazing from how advanced she was from 1820 to 1910? All right, is her lifespan. So it's amazing that back then that this Florence Nightingale, she was serving in the Crimean War, and she founded views on sanitation and hygiene. Okay, so she really focused on hygiene and how it could prevent infection. So isn't that amazing being from back in the 1800s that we had someone who was like, hey, I think if we start being hygienic and, we could prevent infection. So I find her to be very amazing. So then we're going to talk about Clara Barton, and she was an educator and a humanitarian. So she served in the Army during the Civil War and later founded the disaster relief organization as we know it as the American Red Cross. So this is just a little bit of history for you. So I actually take our nursing students to the National Student Nurses Association, and the American Red Cross does a beautiful presentation every year, and they go to all the disasters that we have here in the United States and abroad. So we're still carrying this on. So she was born in 1821. So if you read the history of these theorists, you'll be amazed. So Nola Pender, I love Nola Pender, and she's part of the reason why I wanted to get my doctorate in health science because she's the founder and theorist of the health promotion model. So she's still alive. She was born in 1941, and she has authored books, and she was a professor emeritus at the University of Michigan. So, when you think about all the chronic illnesses that we have, and I love using diabetes when we think about that, diabetes, and how if we could promote health promotion, and we talk to people about just making little changes in your diet and doing some exercise, maybe increasing activity, anything is better than nothing. So, if we could do that, we can have positive outcomes in healthcare. And, type 2 diabetes is very preventable, um, and it could be cured and reversed if people would change lifestyle habits. So I really love this nursing theorist. And, as a nurse, you're going to do a lot of education and you will see diabetic patients and you'll get to talk to them about their goals and you'll get to talk to them about how they would like to improve their health and you'll be able to create realistic goals with your patients regarding lifestyle modifications. So, Sister Callista Roy, she was a nursing theorist as well, and you could read this PowerPoint slide that I have here for her. But she had the adaptation model. She had a holistic approach to care, and she talked about mental health and spiritual health, emotional health. And she is great nursing theorist who, you know, currently we are talking about, especially after the pandemic and everything, and really talking about mental health and wellness, and talking about spiritual health and wellness, and emotional health and wellness, and how important this is to nursing. And so I encourage you to read a little bit more about uh, Sister Callista Roy. All right, so Dr. Jean Watson, she was an amazing theorist too, one of my favorites as well. She had the model of caring and just being humanistic with people and coming down to their level. And in nursing school, we talk to our students about sitting down with the patient and talking to them at eye level and engaging them in conversation and building a rapport with your patient. And that is the art of caring. And it really is an art. If you want your patients to open up to you about how they're feeling and what's going on, they will open up to you if they realize how much you care about them and want them to recover and get better. So Dorothy Orem is another theorist that I really like, and she actually is has the self-care model. And it's very important that our patients can go home and take care of themselves so that they have good patient outcomes. And if for some reason they cannot, then we make sure they go into a skilled nursing facility, or that there's someone at home that can help and assist with their care. So I love the self-care model, and this identifies if there's a self-care deficit with our patients. And sometimes there is. Sometimes patients have self-care deficits and they need to have help at home. But this is a really good theory, and it helps us as nurses to make decisions on the discharge component of our patients going home. All right, so my last slide for you before we end this video is about the American Nurses Association. This is our organization for nurses, and they represent the interests of about 4 million registered nurses in the United States. They are at the forefront of improving quality of healthcare for all. They represent us in Congress with healthcare related issues. They were founded in 1896. So this is a great organization, and I'm actually a member of the American Nurses Association. And what's really nice about being a member of the American Nurses Association is that you have access to um, journals. There's like 3 journals that they have, the latest updates on what's going on in Washington, D.C. related to healthcare. So you could learn a lot about your profession. You could actually work with them. If there are issues going on, you can contact them and they will work with you. So I hope you enjoyed the information regarding nursing today and a little bit of history using our nursing theorists that have paved the way for nursing. And I hope you think about going to nursing school and becoming a nurse and joining our profession. People need you and your community needs you. So I look forward to talking to you in the future. And I believe that you could put comments in the YouTube video, give me a like, you can follow me. I plan on trying to place a video in my YouTube channel at least once a month, if not more often, as I work full time as faculty and I become very busy. So I'm going to try to make a goal of doing this at least once a month and talking about what's going on in nursing, something with nursing school, um, any kind of issues going on in healthcare. We will open it up. And if you you want to ask me questions, you can, and we'll talk about that in the video. So have a great day.